Today we are giving you an update about our healthcare program in Uganda from our office in London. We would want to thank our partners who have been able to support us to provide quality healthcare programs for disadvantaged rural communities in Uganda, in northern Uganda. We have been able to provide healthcare programs in Aduir community, which is in Aleptong district in northern Uganda. We have also been able to provide healthcare programs in the community of Abako, which is also in Aleptong district, northern Uganda. And also we have been able to provide healthcare program in the community of Alemere, which is in Amwala district in northern Uganda. This has been possible because of the support that our partners gave to us. And in particular, we want to thank so much our partner Christian African Relief Trust, who have been working with us for over nearly 20 years. They have been providing every resources, money, materials, donation in kind to support communities in northern Uganda. Recently, we have embarked with them into a program of building a maternity unit at Alemere Medical Aid, Uganda. And the maternity unit is now nearly completed. It should be completed by the end of this month. And we should be able to open that by the end of the month. I also would want to thank so much the partners that we have been able to get from Uganda. So all the projects we run in Uganda, we work very closely with government of Uganda and with the local governments of Uganda. They have been able to support the communities by providing primary healthcare funding, which helps the hospitals and the health centers to run primary healthcare for those communities. They have also provided money for us to buy essential medicines for it to be used in the hospitals and in the health centers. At the moment, we are in great need for some vital medical equipments because we anticipate that the maternity unit should be completed by the end of this month. And without the equipments, the maternity unit cannot run effectively. So we shall appreciate any support, any donation in kind or in cash for the maternity unit to get the equipments. And also, we also would appreciate if you look at the picture there, you've seen that mothers are walking long distance to come to the health centers. They are coming on foot, they are coming on bicycles, and for those who can afford motorcycles, they come on motorcycles. And obviously, with all of those, if there is urgency for the patients to reach the hospitals quickly, it may not be very convenient. And that's why we want to appeal if we could get support towards acquiring an ambulance or a minibus that can be used to transport patients from the rural villages to bring them quickly to the hospital. The ambulance and also can be used to transport patients that will be referred for more specialized treatment. And this village, Alemere Community Health Center, is nearly 70 miles away from the nearest referral hospital, Lira Hospital. And it's like nearly about 400 miles away from Mulago Hospital that offer specialized treatment. And that's why the need for the ambulance is urgent, so that in case the facilities receive patients that require a lot of urgency treatment, they can be transported quickly to access specialized treatment. And also, being a rural village, source of electricity is not available, and the only way we can offer power, electricity to the health center to power the equipments and the operation equipments and delivery equipments, we will need solar power. And we want to appeal also to donors or people who can provide us with funding or donate solar power in kind, so that we can provide power to these facilities. And of course also we want to thank all the supporters for Made It UK, who have always stood with us and have always given their support in kind or by cash. So Made It UK is run by trustees and by volunteers who give their time. And so I would want to thank both the trustees of Made It and also the volunteers of Made It. Thank you.